Hi, I'm here at the NPHIC booth at the 2013 Public Health Preparedness Summit. There's more than 1,600 people attending this year's summit, and it's been really an action-packed week. So many different sessions and workshops and general sessions and choices, things to go to, just a lot of folks interacting and networking. We're here in the exhibit hall right now. That's where the NPHIC booth is. And I had an opportunity to talk with Conference Director Jack Herrmann about what is coming up on Friday.
And on Friday, we're going to end the conference talking with some of our state, local, and federal representatives on how do we meet the public's expectations during disaster. We know that during disasters, the public expects a lot from its governmental agencies, and so we're going to spend some time understanding better how we were able to meet the public's needs during Hurricane Sandy, and then what we need to do to focus on future.
One of the sold-out workshops is happening about 3 levels below me right now in a secret conference room where several NPHIC members are teaching other public information officers how to face the media.
Laura and I have done over the last 5 or 6 years this session in New Jersey. So we added Rita Obi from Texas, Harris County, Texas, to join us, and it's a advanced spokesperson training. The media is going to be there. We have to be ready in public health to respond to that in a very positive way, giving people protective things to do. So we're lending our expertise, if you will, everything we know about risk communication, and actually applying that in responding to the media.
What are you finding, Rita, that people need maybe a refresher course on or some training on as far as being a media spokesperson? What kind of issues do they need to work on?
Well, a lot of people have been concerned about the bridging statements and how do you get back to your message, your main message? How do you make sure that the media captures your story? And so we've been helping them with that, and they're having fun with it, and we encourage everyone, if you get an opportunity, if you're in Jersey, to look Tom up and talk with Laura. It's a great team.
In fact, Tom's personal phone number is 555-121. Laura, what are you doing with the camera out there? You are putting people under pressure.
I am. Well, better to have training here and to go a little off course in training rather than in real life. So we're giving them real life hands-on application of risk communication, media training, and how to answer questions to make sure you get your messages out, not just answer reporter questions. So really working with people who may or may not have a lot of experience doing media interviews.
One of the things we always see, and we saw it, we just did our first round of tapings, is people who think they're not that good are better than they think.
Yes.
And people who think they're the good,
Oh, God.
another story needs some work. And really the moral behind that story is you need to practice. It's not a skill that you get once and have forever.
So being prepared for an interview, I mean, that's key.
Oh, preparedness is always key. We're at the Preparedness Summit.
Yeah.
Yes, and one of the things we've been telling them is make sure that you do practice. Make sure that you know what your message is in advance. Work with your communication professionals so that they can assist you with that message and help you to go over the message before you get on camera rather than after.
And they talk about things they're very familiar with, and in terms they're very familiar with, and their colleagues know what they're talking about. But you're not talking to the colleagues, you're not talking to the media, you're talking to the general public. You have messages you want out, they got to be simple, you have to anticipate what those questions are, prepare the message, and then practice it.
And that really means translating the public health jargon that we have.
Absolutely, not using acronyms, using regular, everyday words that everybody knows. It's a little bit more difficult than you might think.
We gave the challenge out, as we do to every class that we do, if they can be acronym free, and they already are not.
We did not succeed, yes.
Twice, actually, in that first round of interviews.
Yes,
So
yes.
it is harder than you think, because we use a lot of terms very free and normal with our colleagues that the general public just doesn't understand or are used to.
We know what it means, but it may not translate to the average Joe on the street. Yeah.
Meantime, back at the booth, Bill Walker from NPHIC, is it true that you're bowling for business cards?
We are bowling for business cards. We're inviting people who serve as a PIO or a risk communicator or know someone who serves in that role to join NPHIC. We're going to, with these business cards, we're going to have a drawing after the summit for a 1-year free membership in NPHIC, and hope that those things turn into a paying membership, because they're going to see the real value that NPHIC is.
Absolutely, and the cool thing is, folks, we've got like a whole pile of cards of people who are potential NPHIC members, so it's very, very exciting. That's our update for now with Bill Walker in the background. I'm Kerry Shearer for NPHIC at the Public Health Preparedness Summit.